Hello, everyone. First thing I want to do this morning is to share an update about the Ukrainian International Airlines tragedy that took so many innocent lives earlier this year. Even as we face this new crisis, families and loved ones continue to grieve and seek answers. I want to ensure them and all Canadians that we have been working hard to get accountability and justice, even as we fight this pandemic. At the same time, we've also been developing a strategy with our other international partners to make sure that such a tragedy never happens again. Today, I'm appointing the Honourable Ralph Goodale as my special advisor for Canada's ongoing response to the downing of Flight 752. With his decades of extraordinary service to Canada, including as Minister of Public Safety, Ralph has the right expertise to guide our response to this air disaster and provide recommendations for best practices going forward. He will also continue to push to see families properly compensated. The second thing I want to do is share a story with you. A few weeks ago, Dave Caputo, the owner of a startup in Trustcore in the Waterloo region, called a meeting with his employees. With mounting concerns around COVID-19, Dave asked his team how they could repurpose their building materials factory to make products hospitals needed. A few days later, they had 4 prototypes drawn up. They decided to make large panels, which hospitals could use to subdivide rooms and isolate people with COVID-19 from other patients. Well, on Monday, panels made of fully recycled materials were delivered at no cost to several hospitals in the region, including Grand River, St. Mary's, and Guelph General Hospital. Dave and his team showed what Canadians do in difficult times. We don't back down from a challenge. We roll up our sleeves and we get to work. I know that this pandemic has been incredibly challenging for people right across the country, but we're also seeing the best of what it means to be Canadian. From coast to coast to coast, businesses are retooling to produce face shields, ventilators, hand sanitizers, and other supplies our healthcare professionals need. To make it easier for companies to help out during this critical time, we launched Canada's plan to mobilize industry to fight COVID-19 a little over a week ago. In the time since, we've spoken directly to almost 3,000 companies who've reached out to offer their help. Before we go any further, I want to thank all the owners and entrepreneurs and managers who've answered our call to action. This vital support comes at a critical time. And the way you looked around and said, not how can I keep myself safe, but how can I keep myself and my employees safe and help out in this critical time, is a real sign of leadership and a sign of what Canadians do best. In tough times, we pull together, we're there for each other, we put up our hands and we ask, how can we help? I also want, in the same vein, to thank everyone who's making, shipping, and delivering these products. People who work on the manufacturing sector and in terms of getting people the items they need are on the front lines of this fight. Our country needs you through these tough times, and we thank you deeply for everything you do.
When we announced the Canadian plan to mobilize the industrial sector to help against COVID-19, we said that we were concluding deals with Northern Health Medical, Medicom, and Spartan Bioscience. Today, we're announcing the signing of procurement contracts with those 3 Canadian companies in order to build or fabricate medical supplies, ventilators, masks for doctors, and also tests for I want to congratulate Mr. Minister Bain for the signing of those deals, and we sign other deals with these companies, Irvin Oil, Calcan Group, and Stanfield, as well as 2 others. By mobilizing the industry, we can produce here in Canada articles professional for our health professionals to protect their own health, treat patients who have COVID-19, and slow down the propagation of the virus.
We said that we were close to reaching agreements with Thornhill Medical,
louder in my ears,
Medicom,
please.
and Spartan Bioscience. Today, we're announcing that we have moved forward with contracts with these 3 Canadian companies to make medical supplies such as ventilators, surgical masks, and test kits. I want to recognize the great work Minister Baines has done to make this happen. We've also signed letters of intent with 5 other companies: Precision Biomonitoring, Fluid Energy Group, Irving Oil, Calco Group, and Stanfields. We know that the demand for critical equipment and supplies will grow in the coming weeks, so we need a sustainable, stable supply of these products. And that means making them at home, and we're optimistic that they will be available in the coming weeks. So today, I'm also announcing that our existing next-generation manufacturing supercluster will be leading companies in developing and scaling up new technologies to test and treat Canadians. Demand for these goods is going up, so we're making sure Canada is ready to keep up. That's why our government is also allocating $2 billion to purchase protective personal equipment, including for bulk purchases with provinces and territories. This includes things like more masks and face shields, gowns, ventilators, test kits and swabs, and hand sanitizer. Protective personal equipment is essential to protect our healthcare workers who are on the front lines of this fight. We recognize that more is needed, and everyone is working day and night to receive essential supplies. We're coordinating with the provinces and territories, the Public Health Agency, and the experts to make sure our healthcare workers get everything they need. This is a priority for our government, and we will continue to source new solutions every day. We're expecting shipments to come in the coming days, and we will continue to work tirelessly to get these supplies to where they're needed. Plusieurs entreprises ont également fait des
Companies
dons
have also
d'équipements et de
made
matériel
some
médical
equipment
pour
gifts and
contribuer
also
à la
medical equipment donations in order to help against the fight against COVID-19. Alibaba sent us millions of masks and tens of thousands of tests. The group Medical Support, who gathers health professionals, engineers, business people, and representative caritative organizations, are working with many companies in order to provide medical supplies. Up to now, they've obtained a commitment from Bombardier, 3M, and Tektronix to fabricate personal protection equipment, and Toys R Us has committed to give monitors or baby monitors for Canadian hospitals to foster better communication between patients and health professionals, and those monitors will reduce the useless moving of personnel within the hospital. I want to thank the many companies who made a donation for their generosity and their leadership. You do your part, and all Canadians will have to follow your example.
That we will need more masks, ventilators, and testing kits. But how many more we need depends entirely on you. If you stay home and follow public health recommendations, you can slow the spread. And that means fewer patients in our hospitals, fewer people to test, fewer ventilators to use on critical patients. So keep doing your part and help us keep Canada safe. Merci beaucoup.
Merci beaucoup, Monsieur le Premier ministre. Nous allons commencer avec la période de questions par téléphone aujourd'hui. Modérateur, c'est à vous.
Thank you. Merci. The first question, Maura Forrest, Politico. Your line is open.
Thank you, Prime Minister. Yesterday, you were asked about pipeline construction continuing on the Trans Mountain expansion, and you said you'd have a better answer today. Now, Jason Kenney is saying construction will start on the Keystone XL pipeline as early as April 1st. Do you have concerns about construction continuing on these projects? Do you think it should stop?
I can assure you that Crown corporations, all Crown corporations, are following all the best medical advice. Je peux vous assurer que
I can assure you that all the companies, all the government companies are following all the advices given by our medical experts.
Follow-up question, Politico.
Yes, I mean, that didn't really answer my question. I guess that means you're comfortable with construction continuing. But my follow-up question is about the wage subsidy. You initially promised it at 10%, then last week it was hiked to 75%, but still seemed to be targeted towards small and medium-sized businesses. Now it's available to all businesses. I'm wondering why you've taken such an incremental approach to this measure, given that you're now asking employers to hire back people that they've already laid off.
This situation has been evolving rapidly, as we all know. We're putting in place unprecedented measures to respond to the needs that people are expressing on how we're going to be able to get through this together, how we're going to be able to stay home, self-isolate, not go into work, and yet still be able to pick up our economy when we're through this particular crisis. That is the focus that we've had, and that's why what we're offering is a 75% wage subsidy to companies large and small, nonprofit sector and charitable sector included, so that people can stay on the payroll while they stay home and stay isolated, so that we can ensure that we do bounce back strongly from this once we're through this period.
Merci. Prochaine question.
Thank you. Merci. Next question, Mike Mansfield, the Canadian Press. Your line is open.
Good morning, Prime Minister. You talked about shipments coming in the coming days and the fact that more will be needed, obviously. So I think what I'd like you to do is, can you walk us through your decision-making process around the cabinet table, how you decide how these scarce medical resources will be allocated in the near future? How precisely in detail do you decide what goes where?
Thank you, Mike, for your question. It's a very good one, and I can tell you that we don't decide around the cabinet table. It is not politicians who decide how resources are allocated. We rely on experts, on medical officials, on coordination between medical officials in all different provinces to make the determination on where things are most needed, and we follow the direct advice of medical experts in terms of how to ensure that everyone, everywhere, has the equipment they need.
Follow-up question, Mike?
So what input? Yes. So what input then are you looking for from provinces and municipalities as they struggle with this? And does this ramp up of Canadian production, is this a reflection that this has to be a made in Canada solution? We can't rely on exports or imports from the United States, let's say?
We continue to work very, very closely with the provinces to know exactly what the needs are, what the supplies are, where potential gaps might be appearing, depending on trend lines and different modeling. We are in constant communication to ensure that the resources needed in different parts of the country will get there exactly when they're needed. And on the second question, yes, on procurement, the entire world is trying to get its hands on the various equipment needed to fight this virus. That is why we know that it'll be important to be able to have made in Canada solutions. And I am incredibly, incredibly proud of Canadian companies, Canadian suppliers and manufacturers who are stepping up and saying, we want to help, we will help make ventilators, we will help make masks and gowns and all the things that we are going to need in the coming weeks. It has been a truly amazing and inspiring story to see how many factories and manufacturers are stepping up. In the meantime, we're continuing to work very hard on procurement solutions to get the items that we need for the coming weeks. Okay.
I'm first extremely inspired by what manufacturers and Canadian companies are doing. We acknowledge that there's a big request across the world for those equipment, and it will be important to have solutions made in Canada that we can, so we can meet our own needs for the weeks and months coming. Now, in the meantime, we are working with all all the provinces in order to look at the level of needs and to coordinate and make sure that the necessary supplies will be there for companies and places that need it. At the same time, we're working with in order to deliver those equipments in the days coming.
Prochaine question, modérateur.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI, à vous.
Oui, bonjour, Monsieur Trudeau. J'aimerais savoir quelle
Mr. Trudeau,
avez-vous,
what assurance do you have from
les nouvelles, les 5 nouvelles que vous annoncez,
the new
que
5
le
companies
matériel, va
that
être produit à temps pour
the
répondre
material,
aux besoins?
those 5 companies you're announcing today that they will produce material in time. We're currently accelerating this process, but we acknowledge that it will take a little time. We probably speak about a few weeks before this material reaches our Canadian manufacturers. So that's why we are continuing to accept to receive material coming from across the world.
D'accord. Et concernant... Oui, merci. Et pour Medicom,
Now, regarding
va
Medicom,
produire des masques,
that will produce masks,
N95,
the M95 type of masks. How many masks are ready at this time or will be ready in a short time? I don't have this information, but I know there will be a press conference after this one where they will have the information on the procurement.
Modérateur, dernière question.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir, à vous.
Oui, bonjour, Monsieur Trudeau. J'aimerais revenir...
Monsieur Trudeau, I'd like to come back on
travaux de construction
the
de
building
pour la
work that
grandeur
continues
de
for the expansion of Trans Mountains. You say that you follow the advice of medical community, but there's some indigenous communities are pretty worried to see workers coming and going in their region. Why not suspending the works to protect them from a potential contamination? We understand how much indigenous communities are vulnerable across the country, and that's why we've taken some measures that are special across the country to ensure that COVID-19 would not go into those communities that are often already under much stress when we talk about their medical system and with the amount of people living in each habitation. So now regarding the work, I'm trusting that that the company is taking all the necessary measures to keep people safe. On the follow-up, on another topic, on the Canadian emergency benefit, don't you fear that there is a dissuasive element, that it's $2,000 per month, that is better than a minimum salary? Don't you think it would be dissuasive and people would prefer actually to get the emergency amount instead of continue working? Well, I understand we're in a tough time where the important thing is to make sure that people can isolate themselves, can make the necessary decision, and to keep themselves safe and their families safe. At the same time, we acknowledge that some jobs are more essential than others. And I trust that by working with provinces and by making sure that we can, that everything that needs to be done is done, making sure that Canadians have the necessary money in order to continue to pay their rent and do their groceries will be something that we will continue to work on together.
We recognize that people need money to be able to stay home and pay their rents and be able to buy groceries. This is a situation that is unprecedented, and it was really important for us to get money into people's pockets quickly. We recognize that there are going to be challenges around certain essential services, and we're going to work with provinces, and we're going to encourage people to find solutions that will allow people to stay safe while they continue to do the job they need to do.
Prime Minister, I'm wondering, you've talked a lot, and your cabinet ministers have talked a lot about there being enough protective gear for healthcare workers, but we're hearing from healthcare workers that they're being rationed and that they're concerned, that they're afraid to go into work. How do you explain that difference, I guess, between their perspective and the government's?
I think one of the issues that we're facing with is we're looking at a number of different models where worst case scenarios are fairly dire, but the expected track is reasonable and something we think we're going to be able to manage. I think healthcare workers and everyone needs to keep in mind what the potential worst case scenarios are, and that's why it continues to be so important, not just for us to prepare for every eventuality and be very careful and responsible about how we use the equipment we have, but also impress upon Canadians how important it is that the decisions you make today, whether you go out and how you go out, if you do go out, will have a direct impact on the need that healthcare professionals will be facing a week from now, 10 days from now. That's why it is so important for everyone to keep pressure off our healthcare system by staying home, by making sure that you're making smart choices to keep us all safe.
Pour faire un peu un suivi, M. Trudeau, bonjour.
Just to do a follow-up
Pour faire un suivi à la question de Ryan, on a des
to
infirmières
Ryan's
qui nous
question,
disent
we have
que les
nurses
hôpitaux
telling
leur
us that
demandent
hospitals
de
are asking them to
les
take
emmener à la
masks,
maison, de
to
les
bring them
laver
home,
et de
to
les
wash them,
réutiliser le
and
lendemain.
reuse
Est-ce
them
qu'on est
the
rendu
next
dans une
day.
pénurie
Are
si
we
grave que les
in
infirmières
such
et les
a
travailleurs de la
shortage
santé
that
doivent se mettre en
nurses and
danger?
health workers must put themselves in danger like this? I believe that we're in a time that we need to be ready for any eventuality, and it's responsible to look at ways to stretch and make sure that we have a good supply of material for potential scenarios in the days coming. But I can assure you that we're working day and night to deliver other equipment, and we are working with our companies, our Canadian companies, to produce more, and we are once again reminding Canadians that the choices we're making today, if we stay home, if we get out, will have an impact, a direct impact on the needs and the traffic in our health system in one day and a week in 10 days. So that's why we need everyone to do our part.
It's important for everyone to do their part in staying home, in making sure that a week from now, 10 days from now, we aren't overwhelmed in our healthcare system. We are looking at a range of models that could lead to different outcomes. We're, of course, preparing for the worst case scenarios, but working towards and certainly hoping for a best case scenario. But that entirely depends on citizens being responsible in their choices. As for decisions made by medical professionals on managing the supplies that they have, I can only salute them for the work that they're working so hard and the decisions they're making to keep us all safe as a country and to keep themselves safe so they can keep keeping us safe.
Au niveau international, il y a une mini-guerre
across the world. There's a mini war now for the purchase of medical equipment or medical supply. Don't you worry that Canada will end up with a shortage? Are you worried about this? I think there's many things should preoccupy us. The health of Canadians is my first preoccupation, and inside of this, the health of our health workers who are there keeping us safe. We are working with our embassies abroad to ensure the supply of other material. We're expecting to get in the days coming also, and we will continue to be present to accept the delivery in Canada of those products. And at the same time, it's so important to create an industry that will create those measures, these equipment here at home, that we have supply chains all inside the country, and that's exactly what we're doing. And I want to thank once again the manufacturers and companies who were able to adapt their production and start to produce these equipment that is so necessary for Canadians and for people across the world.
We are, of course, working hard to make sure that we receive shipments of needed supplies in the coming days. And I can assure you that our embassy staff around the world is strongly engaged in exactly that. But that's also why it is so important that we have made in Canada supply chains to provide us with this essential equipment for the coming weeks, for the coming months. And that's why I am so pleased to be able to thank the manufacturers and producers across this country who've switched their production over to making this necessary medical equipment because it will ensure that we have solutions in Canada that will cover our needs.
Good morning, Prime Minister. Olivia Stepanovich, CBC News. The Americans are said to be most aggressively scooping up personal protective equipment on the international market. I'm wondering if you've found that to be the case, and if so, if you have prevailed upon President Trump to work together to come up with a common North American strategy so you can quickly shift ventilators and other personal protective equipment across the continent to priority areas.
We are working very hard to ensure that Canada receives the equipment that we need, both in the short term and in the medium term, creates production facilities to ensure that we can cover our needs. We understand that countries around the world are taking their own approaches. We will continue to coordinate as much as possible, but every step of the way, our priority will be ensuring that Canada is able to take care of its own.
But are you working with President Trump on a North American strategy? And also, can you tell us exactly how much medical gear has been deployed and delivered so far?
We have been able to cover all our needs up until this point, and expect to be able to cover our needs for medical equipment in the foreseeable future. But that is why it is so important for us to ramp up domestic production as well. And with the United States, we continue to coordinate on a broad range of issues. Nous allons continuer de coordonner avec les Américains sur bien des
Americans on many issues, but our preoccupation will always be to make sure that Canadians have all the equipment they need to stay safe and
How much
healthy.
medical gear has been deployed and delivered so far?
That's a question for the ministers who will be addressing this a little later today.
Brian Mullen, Global News. Prime Minister, with rent due tomorrow, many small and medium-sized Canadian businesses are worried about paying their landlords. What can the federal government do? Is rent forgiveness in some shape or form on the table?
We've already worked with CMHC to ensure that many mortgages are able to be deferred. We've put more money in the pockets of businesses, or putting more money in the pockets of businesses through this wage subsidy, the 75% that will take off a significant amount of pressure. We've also made available a $40,000 loan for small businesses through the banks that'll be interest-free for the first year, and as they go through it, $10,000 of it under certain conditions will be non-repayable at the end. So there are direct measures for companies to be able to get the liquidity necessary to get through the coming months so that we can be strong once we get through this crisis at the end of it.
2 First Nations communities in Manitoba and other communities are requesting military hospitals be set up. Is this something that the government is contemplating for remote communities with limited access to healthcare?
We know that our military, the men and women of our military, are always ready to serve, to help in a broad range of ways Canadians who need that support. The field hospitals is certainly an expertise that the Canadian Armed Forces have, and they will make determinations, and we will all make determinations about how we can and where we can best help if it comes to that.
Hi, Prime Minister. Molly Thomas, CTV National News. Canadians, of course, are putting lots of money on their credit cards. They're raking up interest. Last week, you had mentioned that you had talked to banks about possibly deferring that interest. Any more movement on that?
Those conversations continue with the banks. We're also looking at ways of easing access to credit for individuals so that they can shift their bank balances and their credit card balances to a lower interest line of credit. These are things that we're continuing to work on because we recognize that Canadians don't want to come through this with impossible levels of debt, and we're going to be there to help them out.
In French, please.
Nous reconnaissons que
We acknowledge
on ne
that
veut pas que les gens
we don't
sortent
want
de
people
cette
to
crise encore plus
come out of this
embêtée
crisis
qu'avant.
even more
C'est
in
pour ça
depth
que
than
nous
before. So
envoyons
that's why we are
tellement
sending
d'aide par la prestation
so much
canadienne
help through the
d'urgence et de
Canadian
l'aide pour
emergency
la subvention
benefit
aux
and
entreprises,
also
pour
the
la masse salariale.
subsidy for
Mais nous savons
employee
aussi que,
salaries.
on peut
But
travailler
we
avec
know
les
that we
banques.
can
On est
work
en
with
train de
banks, and we are
travailler avec les
currently
banques
working
pour
with banks
encourager,
to encourage them
de faire des changements au taux de carte de
to make
crédit.
changes to
Et
the
on est
credit
aussi
card
en train
rates.
de
And
regarder
we are currently
l'accès au
also
crédit
looking
pour
at
les
access to
individus
credit
pour
for
qu'ils
individuals
puissent,
so that
avoir
they
des
can
emprunts qui vont coûter
have
moins cher
loans
que
that
les
are
cartes de crédit.
not as
So we're
costly
seeing
as credit
reports
cards.
that after more than a year, China is going to allow Canadian exports of canola. Can you confirm that? And is this a thaw in relations between the two countries?
I think we're recognizing that we're in a global situation where it is really important for countries to work together. We have seen promising signs of positive relations on specific issues, and we're going to continue working to try and ensure that our farmers, our manufacturers, our exporters continue to have access to the markets around the world, even in this difficult time. Okay. Nous allons continuer de travailler
We will continue to work
avec
with
nos fermiers, avec nos
our
producteurs
farmers,
pour assurer
our
qu'ils ont des
producers,
marchés
to
pour,
make sure that they have
leurs
markets
biens.
for their goods.
On reconnaît c'est un moment
We
où
acknowledge
les
it's a
gens
time where
doivent travailler
people must
ensemble,
work
les différents
together
pays doivent travailler
from different
ensemble.
countries. They
Je suis
must work
content de
together,
voir
and I'm
aussi
happy to see
qu'on
signs that
arrive à travailler
we are
ensemble
getting
malgré,
to
les
work
différences
together
importantes.
despite the
Merci beaucoup,
difference,
c'est tout. Merci
important
pour la conférence de
difference.
presse aujourd'hui.
The Prime Minister's questions